Well, stroke is one of the leading causes of death in the United States. And one of the causes of stroke is related to blockage in the carotid arteries. It is estimated that there are about 800,000 strokes in the United States annually. It's also estimated that there are about 150,000 deaths related to strokes. This is slightly more prominent in women than men, but certainly affects both sexes. Risk factors for a stroke can be broken down into one of two categories. One of those is uncontrollable factors, and that's typically your genetics or what you inherit from your family. The second category is controllable factors, and those are factors that you can modify or change to decrease your risk of stroke. Examples of that would be cigarette smoking, high blood pressure, high cholesterol, diabetes, obesity, physical inactivity. Another risk factor is heart disease. We know that if you have a history of heart disease, you're more than twice as likely to have a stroke in the future. Stroke symptoms we can classify into four general categories, and these would be sudden changes in either your sight, your speech, your strength, or your sensation. So examples of those would be related to the sight, might be a sudden blindness in one eye or the other. Example of a speech problem would be slurring of the speech or difficulty getting your words out. Sensation issues might be the sudden onset of numbness or tingling on one half of your body or the other. And strength issues would be the same kind of issue, just a sudden loss of strength or weakness on one side of the body. The permanent impacts of a stroke can result in complete paralysis on one side of the body, inability to speak, inability to eat, and certainly have a dramatic impact on somebody's lifestyle following a stroke. Unfortunately, most people don't have any symptoms prior to having a stroke. About 80% of people who have a major stroke have never had a preceding symptom, and therefore that's why it's important that we try to identify people, particularly that have blockage in their carotid arteries, before they have any symptoms or a stroke. One of the typical ways that we see is that a patient will go see their primary care physician for a routine exam. At that time, their physician will listen to their neck with a stethoscope and may identify an abnormal sound called a bruit. This may indicate carotid blockage and typically will result in the patient receiving a carotid ultrasound scan. The second way is by community screening, where patients will go out and have a carotid duplex scan as part of a health fair or screening. And the third way is in patients that have a stroke. As part of their workup, they will undergo carotid scanning, which may identify a resulting problem with their carotid artery. Treatment options can be broken down into three categories. One would be medical management. That is treatment with medications such as aspirin and cholesterol medicine. The second would be with carotid surgery. This is an operation where we go in and remove the plaque buildup in the carotid arteries. It's one of the most common operations performed by vascular specialists in the country, and it's been done for many years and has very good results. More recently, we've had the option of placing stents within the carotid artery. These are typically reserved for patients who are higher risk for surgery and would not be good candidates. Surgery for carotid artery disease has been done since the 1950s, so we have lots of follow-up time, and we know that the complication rates, particularly related to strokes during the surgery and the risks of nerve injuries, are very low. Although we have the option of doing carotid stenting, we typically reserve that for higher risk patients, as this is a newer procedure and the long-term results aren't as clear as those with surgery. One of the most important messages for patients is that if they think they are having any symptoms related to a stroke, that they seek immediate medical attention. This may mean calling 911, going to the emergency department, or seeing their local physician. We know that it is very important for the rapid recognition of stroke symptoms, as well as the rapid transport to a medical facility, and lastly, the rapid diagnosis and treatment of their symptoms. These all lead to the best possible outcome related to stroke.